we will discuss the moral issue of birth deformities. Birth deformities are defects, malformations, or abnormalities of a child which are present at birth. Types of deformities: genetic deformities, hereditary, and congenital deformities, non-hereditary. Genetic deformities refers to medical conditions or disorders caused by alterations in an individual's genetic material, DNA, that are passed down from parents to offspring, also known as inherited or hereditary diseases. Example: Down syndrome, a genetic condition caused by an extra copy of chromosomes 21, leading to intellectual and physical difference. Spina bifida, a birth defect in which the spinal cord doesn't close completely. Marfan syndrome, a genetic disorder that affects the connective tissue, potentially causing problems with the heart, blood vessels, eye, and skeletal system. Congenital deformities are structural or functional abnormalities present at birth that are not caused by inherited genetic factors, but rather by environmental factors during pregnancy or at birth. Example: heart defects, structural abnormalities in the heart, such as missing or misshaped valves. Arthrogryposis, a condition characterized by multiple joint contractures. Club foot, a foot that is twisted inward or downward.
Moral issues surrounding birth deformities or congenital disorder arise from complex ethical considerations, including the value of life, the right to choose, and the potential for prenatal diagnosis and intervention, often leading to difficult decisions for individuals and families. Value of life. The fundamental question of whether a fetus with a birth defect has the same right to life as a healthy fetus is a central ethical debate. Autonomy and choice. Parents' right to make decisions about their pregnancy and potential interventions for a child with a birth defect is a crucial aspect for autonomy, while the role of healthcare professionals in providing information and guidance is also important. Quality of life. The potential for a child with birth defect to have a meaningful and fulfilling life is a factor in ethical decision making, with some arguing that certain conditions may be considered incompatible with a good quality of life. Prenatal screening and intervention. The ability to detect birth defect prenatally raises ethical questions about the use of this knowledge, including the potential for selective abortion and other interventions. Social justice and equality. Birth defects disproportionately affect marginalized communities, raising questions about access to health care and resources for affected individuals and families. Impact on families. The emotional, financial, and practical challenges faced by families of children with birth defects are significant, raising questions about social support and resources. Specific ethical dilemmas. Termination of pregnancy. The decision to terminate a pregnancy after prenatal diagnosis of a birth defect is a highly contentious issue with ethical arguments on both sides. Intervention versus non-intervention. Decisions about whether to pursue medical interventions for a child with birth defect, even if those interventions are risky or may not be fully successful, are complex and often involve weighing potential benefits against risk. Genetic counseling. Providing genetic counseling to families who are at risk of having a child with birth defect raises ethical questions about the role of genetic information in decision making.
Kantian principle: malformed baby is a person, then it possesses an inherent dignity and worth. But aside from being defective, it lacks the capacity to reason and to express its will, which, for Kant, are the basis of human dignity. Ross ethical principle: the duty to have a deformed baby be operated on the cost of which is tremendous and burdensome to the family. Thus, the duty to let the malformed child die in a painless and quiet way. For Joseph Litcher, does not only favor the expulsion of terribly malformed fetus and the decision to terminate a subhuman life in extremis in all age, but also endorses the merciful and painless killing of horribly deformed babies and of terminal ill patients. Allowing a malformed baby to die by withholding support while advocating the termination of the same kind of deformity in utero is not only inconsistent and illogical but hypocritical as well. For utilitarianism, the greatest happiness for the greatest member advocates on easy and painless death for terribly malformed baby. Astigmatism, whenever the child deformities are so serious and severe that all medical measures are unnecessary and usefulness, except to prolong, if not exacerbate, the malformed baby's suffering and misery. The most realistic and practical decision to be made is to put its life to a speedy and painless end. The issue of birth deformities can be considered moral because it often raises questions related to ethical and values, such as the right to life, the dignity and worth of human beings, and the responsibilities of society toward individuals and disabilities.